This video is to illustrate how to chart your assessments in the assessment flow sheet in EHR Tutor. It might be a good idea for you to open ATI and pull up EHR Tutor and follow along as I go through the sections in the assessment flow sheet. When you complete an activity in EHR Tutor, most of the time there will be a chart attached. When you're in the course, click on the activity and open the patient's chart. It will open to the patient summary, and in the menu to the left you will find tabs that you can click to navigate through sections of the chart. About midway down, click on Flow Sheets. When you click on Flow Sheets, the drop-down menu will provide you with many different choices. The two that are useful for assessment are vital signs and assessment. There's also a section up above this that's called History and Physical, and in that there's a review of systems, and that may also be useful to you, and we will talk about that in another PowerPoint. When you open the Vital Signs flow sheet, you will see that there are a lot of options on what to chart, and there are drop-downs to select details for each parameter. For instance, when you open temperature at the top, you can enter the value, let's say 98.6, and then you can select the scale that you're using. In this case, it would be Fahrenheit, but you can also use centigrade. You would select the source, oral, rectal, temporal, etc., however you took the temperature. Next is pulse. Enter the value and choose the source, and in this case it will probably be radial or apical. There's also a section for monitor. Your classmates probably will not be on a monitor, and so radial or apical is what you will use in class, but some of your patients may be on a monitor. If you have comments about the heart rate, such as that it is irregular or out of range, too high or too low, list that at the bottom in the comments section and record any action you took. For instance, you held a dose of medication for a low heart rate, or you notified a provider about a rapid heart rate. Blood pressure is next. Record the value and the position the patient was in when it was taken. Don't worry about the mean arterial pressure, or MAP, at this time. This is used in critical care as a measure of perfusion and to titrate medication, so you won't be using it in this program. If you have comments about the blood pressure, it's either too high, too low, or the static, whatever, enter them at the bottom and record any action taken. For instance, you held a medication for a systolic less than 90, or you called the provider because the systolic was over 200. Next, you will record the respirations, oxygen saturation, and oxygen source. The source is either room air or the device used to administer the oxygen, and then the oxygen flow rate, if applicable. Again, the comments below can have such details as what the SATs were before or after suctioning, or other pertinent details. Enter the patient's pain level according to the scale you used, either the numerical or the FACES scale. And the comments again could include maybe before or after pain meds or similar descriptions. And then finally, if it's applicable, enter the value for the glucose monitoring finger stick there at the bottom. Comments here could include interventions such as giving insulin for a glucose level that's too high, giving carbs for a glucose level that's too low, notifying the provider, asking for a blood draw, etc. So that is a summary of the vital signs page. If you click on the assessment flow sheet and scroll up and down, you'll see that it takes you through the body systems. There are blank spaces to enter data, and then there are some drop downs as well. Click on the drop-downs in each section to look for descriptions of your findings. The comment section are free text, and you can enter more detailed descriptions of your findings there, or findings that you can't document in the drop-downs. You can chart data about the head, face, and neck here. From the drop-downs, you can select common descriptors. There's a section on fontanelles here, and that's information you will need when you chart on babies, perhaps in your pediatric or OB courses. Head and face descriptors include normal, such as normocephalic, symmetrical, and abnormals, such as a headache, which is a symptom, or hydrocephalus. Skip the fontanelles again, as you're only assessing adults for now. Neck descriptors could include things like the position of the neck, range of motion, and information about the trachea and the thyroid gland. Use the comment box for things that are not covered in the drop-down, or when you think you need more detail, such as perhaps describing limited range of motion. In this section, you will chart data about the eyes, ears, nose, and mouth here. The drop-downs will give you, again, common descriptors, and use the comment boxes that are separate for each section. The eye descriptors may include many areas, such as appearance, pupillary reactions, drainage, pain, vision. Ear descriptors include placement of the ears on the head, hearing, drainage, pain. Nose and throat section includes details about the structures of the mouth and the throat, also the sinuses in the nose. Use the comment box in each section for details that are not covered in the drop-down, or things that you need to chart more detail on, such as a description of pain or drainage, or perhaps discharge from the nose. The neuro section looks just like the other section, provides drop-downs. You can select common descriptors there, and there's also comment box, but it's for the whole section. You need to skip the deep tendon reflexes, as you will not be assessing those. In my opinion, the neuro section is limited. There are no specific details that you can give about the assessment of cranial nerve data, nothing in the drop-down about that, and so if you need to talk about anything specific, you'll need to use the comment box. There's a section for level of consciousness, and this is a very subjective assessment. When you click on the drop-down, a sidebar will pop up, and it will give you the definitions that EHR Tutor uses for each descriptor in an effort to try to make it less subjective. Orientation, you're very familiar with. Orientation ×4 is used for normal. If the person is confused in any one area, let's say time, then record what they are oriented to, or if you're unable to assess their orientation. Now for speech, there are many choices to describe speech. Here is the first time we encounter the abbreviation WDL, within defined limits. You will see this abbreviation frequently throughout the assessment flow sheet. When it is listed as a choice, there is a pop-up that goes to the side to describe exactly what is meant by within defined limits for that particular parameter. So look at the description, see if it fits, and if it does, then you can click WDL. If not, you'll have to click other things that more correctly describe what you're seeing. For pupils, you describe their reaction to light and then record their size. That's the normal size before you shine the light in them. Again, skip the deep tendon reflexes. And as I mentioned earlier, there is only one comment section for the entire neuro thing here. So use that to record anything you think might need more detail. For instance, if the patient has anisocoria, which means they have one pupil that's bigger than the other just normally. That's an important thing to know when you're assessing someone's pupils. The Glasgow Coma Scale is abbreviated GCS. You'll see that a lot. And it gives you further information about level of consciousness. You could record your observations for responses assessed in the Glasgow Coma sheet with drop-downs in this area. They give you the scoring, and then you add them up to enter the total score at the bottom. The respiratory section will allow you to chart information about your assessments as well as some respiratory interventions. There's a drop down at the top for respiratory effort and pattern. You will chart the breath sounds in the comment box. Be sure to chart the location of the breath sounds and what you hear. So for example, you could chart breath sounds are clear bilaterally, A and P, anterior and posterior. You could chart fine crackles heard in the right base. You could chart expiratory wheezing heard throughout lung fields, A and P. Lots of different ways to chart breath sounds. Also, when you are charting respiratory effort, if you're saying that their breathing is labored and they are perhaps having retractions or nasal flaring, this is something that has to go in the comment box as well. You can't just say that somebody is having trouble breathing and not explain it further. Similarly, there is a drop down to describe cough. You enter the description of the sputum in the comment section. So if you say the cough's productive, you've got to put something about this sputum in the comment section. Be sure to include color, consistency, and odor if it's present. Then in the interventions section, that includes suctioning, turning, deep breathing, incentive spirometers, chest PT, etc. Comments could include how often the interventions are done, data before or after the intervention, for instance, oxygen sats and breath sounds before and after suctioning. There's a section on airways. If the person has an artificial airway, the most often things you will encounter would be ET tubes or tracheostomy tubes. The section on tubes refers to chest tubes. A comment section could include the tube size. If you've got a trach, you could do a description of the stoma. And if they're on a ventilator, you could chart the vent settings, or if they're on BiPAP, you could chart the BiPAP settings. If a chest tube is present, document the suction settings, the type, and the amount of drainage in the chest tube drainage box. Then finally, oxygen source refers to the oxygen delivery device used. So if they're room air, it's room air. If not, it might be a nasal cannula, might be a non-rebreather mask, lots of different choices. So just comment how the oxygen is being delivered, and then also use this section to record the FiO2. FiO2 is the term that you see for the amount of oxygen the person's giving. It stands for forced of inspired oxygen, and that can be 2 liters per minute on a nasal cannula. It could be 40% on a non-rebreather. So chart whatever oxygen level the patient is receiving in the comment section. You could put vent settings there too, or you could put it in above with the airway section. The cardiac section allows charting on physical assessment and symptoms. So there's a drop down for heart sounds, and it allows you to document the rate, the rhythm, and the sounds. The rate just gives you the choice normal rate, but if the person has tachycardia or bradycardia, you need to include this in the comments. The rhythm could be either regular or irregular. If you want to describe an irregular rhythm more, again, use the comment section. For instance, an irregularly irregular rhythm, such as in atrial fibrillation, or a regularly irregular rhythm, as in some heart blocks. The symptoms drop-down covers a variety of conditions, such as edema, dizziness, and chest pain. If you choose one of these symptoms, you must elaborate more in the comments section with a full symptom assessment. You can't just write down chest pain and not describe it in more detail, or edema and not discuss the amount and the location of the swelling. And none of your classmates will be on telemetry or monitors, but you may have patients later in clinical or sim who are, and so you could use that section then. The peripheral vascular section isolates each extremity individually. The drop-down for each extremity has descriptors for you to document data like capillary refill, edema, pulses, and pain. If you select an abnormal symptom like pain or problems with pulses, elaborate on your observations in the comment section. Again, you can't just list something abnormal and then not describe it in the comments section. Now, there are no choices here for skin color, temp, dry skin, sensation, or ulcers present. These are crucial assessments in peripheral vascular disease, so include them in the comments section. They could also go in the skin section, but since they are related to the peripheral vascular system, they really should go here too. The integumentary or skin section is very limited, so use the comment section liberally here. And there's also a wound flow sheet if you need that, and we'll talk about that in the next few slides. So again, the drop downs here are limited. You will have to use the comment section to describe the location of any problems and any details about any problems. You know, there's skin all over the body, so detailed description of each location is required. Make sure you use specific vocabulary if you're describing rashes. Use your Jarvis for this. There are photos and there's medical terminology. So for instance, if the person has urticaria or hives, you can talk about round, red, confluent lesions that the patient says itch or something like that. So under the skin condition, there is a choice that says not intact. And this directs you to use the comment section. Duh. So if you don't have intact skin, there's also a wound flow sheet. It's a separate flow sheet. It's not in the assessment section. And you can use it to describe wounds, incisions, and ostomies. Your classmates probably won't have any of these things, but you should look at this section for use in the future in clinical. I'm now moving out of the assessment section and into the wound section. It has a flow sheet for a very detailed description of a wound. The descriptors here are a bit skewed toward pressure ulcers, but they could be used for any wound. If you're working in clinical with a patient with a pressure ulcer, they may also document it with a push tool. Push stands for Pressure Ulcer Scale for Healing, and this is a number that is determined by the size, the amount of exudate, different factors on the wound, and it's recorded weekly by the wound care nurse to see if the ulcer is getting better or not. Please note that there is a section to insert a photo on the very first line. Facilities have policies about photographing wounds, and you also need patient permission for this, so be sure you have all the details accounted for before taking a picture of a wound. The next section on this flow sheet is the incision section. Again, not in the assessment section, but on a separate flow sheet for wounds, incisions, and ostomies. It should be used if there's an incision present, and please remember, an incision and a wound are two very different things. This allows for a detailed description of an incision, and there's also a comment section if there's anything not covered by the drop-downs. There's another comment section at the bottom for the type of dressing and if there's any packing present. Wound care instructions or interventions could also be included here. In your book, there are a lot of good pictures about different kinds of incisions and different ways to describe them, so please refer to that as well. Again, there is a section to insert a photo on the very first line, and facilities have policies about photographing incisions as well as wounds. So you need permission from the patient, and make sure you have all the details accounted for before taking a picture of an incision and posting it in the medical record. The third section on this flow sheet is for an ostomy. Again, not in the assessment flow sheet, but on the separate flow sheet for wounds, incisions, and ostomies. The ostomy section allows for a very detailed description of the ostomy, the appliance being used, the output effluent, and the ostomy care delivered. There's also a comment section if there's anything not covered by the drop-downs. Once again, there is a section to include a photo on the very first line. Ditto everything I said about policies and permissions, and make sure you know all this before taking a picture of an ostomy. Okay, so I'm moving back to the assessment flow sheet. And after skin, there is the Braden scale. The Braden scale is used to quantify risk for pressure ulcers. It does not document a wound, measure a wound, talk anything about a wound. It is merely about a person's risk for the development of pressure ulcers. This won't be applicable to your classmates, but I want you to think about a patient or a resident that you care for at work and go through this document based on what you know about them and document their risk. When you enter the total score, there's a pop-up that shows you how high the risk is based on that numerical value. For instance, if you've got somebody who has decreased sensory perception, somebody who's incontinent, that counts for moisture. Activity, are they bedbound, are they up? Mobility, can they move by themselves, do they need help? Nutritional status, and then also is the possibility of friction and shear present. Look at all that, add it all up, and the score will be based on the numerical value that you get when you add up all that data. Now you see the scale used in clinical practice all the time. It should be used to document pressure ulcer risk for everyone who's admitted to a facility or an agency so that there's a baseline and treatment decisions can be made on the level of risk. If a person enters a facility or an agency and does not have something like this documented, if they develop a pressure ulcer at that facility is totally responsible for the treatment. Medicare and Medicaid will not cover it. So this baseline skin assessment and ulcer risk assessment is vital documentation. The musculoskeletal system section is, the drop-downs are limited to the extremities. There's a whole lot more to the body besides the extremities, and so there's a comment section that you can talk about all the other areas. When you look at the section on extremities, it documents such descriptions as strength and range of motion. You can use the comment section to further list any abnormal findings in the extremities, such as a tremor or a contracture, or any abnormalities in other areas. Balance and gait are examples of things that are very important parts of the musculoskeletal assessment. You can describe any abnormalities in balance or gait, or list any assistive devices used in the comment section. The GI section includes drop-downs for common assessments, but it doesn't include information on a lot of other things that are really important, such as symptoms, stool, emesis, or nutrition. The drop-downs for the most common assessments are mostly of the abdomen and bowel sounds. Be sure to indicate the date of the last BM. That's super important, and I know it doesn't seem like much, but it really is. There isn't an area to talk about nausea, vomiting, emesis, diarrhea, constipation, bowel patterns, or give any stool description at all. These should all go in the comments. There's also no place to indicate any dietary or nutritional assessment information here, so the comment box would be a good place for that data if needed. There's a malnutrition screening scale in EHR Tutor if you ever have need for it, but for the most part, if there's a nutritional issue, you can put it here in the GI comments. Another thing would be, are they being tube fed through an NG or a G tube, enteral feeding, or are they getting TPN through their IV, which is total parenteral nutrition? You'll learn about these things later, but it's important because if they're not eating, you need to be able to chart these things, and then people will know how they're being fed. The GU section includes drop-downs for common urinary assessments, but really doesn't include information at all about the male or female genitalia, any reproductive data, anything like that. The drop-downs for the urine include a drop-down choice for incontinence if it's present, but if it's present, you need to describe in more detail in the comments section. Is it urge incontinence, just present when they sneeze, or are they incontinent all the time? Lots of different kinds of incontinence, and you need to make sure and describe that. There's also no place to say whether they have a Foley or a condom cath or a suprapubic cath, so that would go in the GU comments. There's also no place to indicate assessment of the male or female genitalia, sexuality, or any reproductive data. If it's pertinent, this information should be included in the comments. The final section is for a complete pain assessment. This area is for pain anywhere in the body and should be filled out in detail, even if you've addressed it elsewhere in the assessment. The comments section could be used to discuss associated symptoms, symptoms that happen along with the pain. Sometimes nausea is one of those, or response to treatment if appropriate. So for instance, they had a pain level of 7 and you gave them something for the pain, and then the pain level went down to a 3. This is the end of the talk about the assessment flow sheet. I appreciate you listening, and I hope it was useful.